Good morning. Welcome back to 1160 AM KBDT News Talk Sports. We're JP, Kathy, and the crew. We come to you live Monday through Friday from 7 a.m. to 9 a.m. And we love to have you join us on Alexa. Feel free to go to your Alexa and go, Alexa, 1160 AM KBDT, or go to the TuneIn app and pull us up on your phone. You can listen to us all the time. And what we don't want you to do is we don't want you to miss Wayne Allen Root, raw and unfiltered, this afternoon from 5 until 8 p.m. only on 1160 a.m. KBDT News Talk Sports. I cannot tell you how excited I am that we are beginning a new segment here on 1160 a.m. KBDT. And really it was brought to my attention and Kathy's attention that, hey, you know what? We talk a lot about mental illness. We talk a lot about mental health. We say that it's important. We try to take it out of the shadows and put it on the forefront. But what are you two really doing? And that's kind of how Steve, Dunn, and Patty, and I love this, Giolet.
Oh, here
was I
we
even
go.
Close? Was I even close?
Yeah. He makes it sound very fancy.
Oh, it's very fancy. It's like I'm having a love affair
Patty
with her
is
name.
fancy.
I love that. They came to us from the Something for Kelly Foundation and the Morgan Foundation and said, what are you guys really doing? John, you are a boots on the ground. Let's get work done. What can we really do? And they came up with the mental health moment. Every Tuesday from 8:34 a.m. until we close out the show, we will be talking about some form of mental illness, mental health. We'll be talking about in all ranges, from depression, anxiety, eating disorders, you name it. We're going to talk about it. We're not going to hide behind the closet door anymore. It is time to come out of the shadows and be a part of what is the solution instead of the problem. And so, Patty, thank you so much for joining us this morning.
Thank you for the opportunity, John. I'm very excited to be here and to start this program.
And then
We're excited.
Steve Dunn, thank you from the Morgan Foundation for being here today.
You bet. And here we're going to have some incredible guests as the weeks and months go by. So excited about that.
We will be posting a list of schedule of different professionals that'll be coming in and talking with us.
And the topics.
Yes. As well. Because here's the thing, right? One of the things I know more than anything else in this world is that we are all at some point touched with mental health or mental illness situations. And so we're just excited to be kicking this off with us this morning. And I cannot tell you how pleased I am that this is our inaugural conversation. It is our doctor joining us this morning, inauguration of the mental health moment. Anyway, I can screw that up. I'm trying to get it all screwed up vocabulary-wise. But we have got Dr. Cynthia Bulik joining us from Chapel Hill, North Carolina at the University of North Carolina. And again, just absolutely, Dr. Bulik, cannot thank you enough for joining us here on JP, Kathy, and the crew in the mental health moment with the Morgan Foundation and Something for Kelly Foundation.
John, I'm honored to be your inaugural guest for this initiative.
You know, you made that sound so much smarter than I did.
Yeah, well, because she is so much smarter than we are.
Oh, fair enough. As Steve shakes his head, and Patty just smiled at me. You know, and Dr. Bulik, we do try to keep things a little bit light, but we also get into the seriousness of it as well. Yeah. Because it's important to understand that, you know, we have to have a good attitude when working with mental health and mental illness because it is hard. It's not easy.
Yes.
My first question out of the gate for you is, what is your opinion? What do you think? You're knee deep into this industry. You are a co-founder at the UNC for the program you started there. You are an executive with the school of psychiatry out there at UNC. Tell me, what is your thoughts about the media, about foundations coming together, and us creating the mental health moment? Is it going to be helpful? Is it a good thing?
You know, John, I think it's not only a good thing, it's an essential thing, you know, and I think back to even when I was younger, when we didn't even talk much about our physical illnesses. But now, you know, people share their cholesterol numbers and their blood pressure numbers, and we sort of like opened up the gates to talk about physical health. But I think what the mental health moment and other moments like it in the media can do is open up those same gates to talk about mental illness. So I guess my goal is by doing this, we all become as comfortable talking about our depression, our anxiety, our eating disorders, as we are about our cholesterol or our blood pressure.
Well, you're right. It's interesting. You know, you see people sharing their weight loss journeys, literally even doing things that years ago nobody would have ever done. the before picture, the during picture, in the good part of the during picture. And so I think what our goal is here at JP, Kathy, and the crew is to be able to do the same thing and break down those barriers so we can talk about mental health. So it doesn't have to be something that people talk about behind somebody's back or in the quiet of your own home. Because again, like what JP mentioned earlier, everyone is touched by mental illness, either by your family or yourself, even if it's something not a depression from the very beginning, or that you have as a permanent basis, but maybe just a temporary thing you're going through. So it's okay to talk about it, and this is going to be the space where we make that okay.
Beautiful.
Dr. Bulik, this is Patty. Thank you so much for being the first guest. Even though this is our first mental health moment episode, it's not your first time with us, so I think it's very appropriate that you are joining us. Dr. Bulik, as you well know, my interest in mental health is started with eating disorders. We lost Kelly, my niece, to anorexia, and that's how you and I got connected. The mental health moment is about all things mental health. And so what I'd like to ask you to speak to a little bit this morning are co-occurring issues around eating disorders, because this is a mental health moment, and I know that I learned long after Kelly died that there is a very high rate of co-occurring illnesses inside of the world of eating disorders. Could you speak to that for a little bit?
Absolutely, and it's wonderful that you mentioned Kelly in the first breath, and that it was Kelly and Morgan that really sort of launched this idea. And this topic of co-occurring illnesses is really important because even for this moment in this movement, we talk about disorders singularly. Like today we're going to talk about depression. Today we're going to talk about eating disorders. Today we're going to talk about anxiety disorders. But in reality, a lot of these illnesses go hand in hand. And when we talk about co-occurring illnesses, it can mean either they're happening at the same time or they happen sort of sequentially at different points in people's lives. And I'll dive right into the eating disorder since that was your question, because they frequently co-occur with other mental illnesses. So about 80% of people with eating disorders have depression at some point in their life. And even after they recover from an eating disorder, sometimes that depression still lingers. So it's really important that that's attended to at the same time the eating disorder is attended to. And then adding to that, about 70% of people with eating disorders have anxiety disorders. And I think one of the things we've seen with anxiety disorders that's fascinating is they actually tend to appear before the eating disorder is. So if you dig back into the history of someone with an eating disorder to figure out sort of where did things start, often you hear stories about them being a very anxious child. And the question, of course, is, chicken or egg, what came first, the eating disorder or the anxiety disorder? But from a treatment perspective, the important thing is that we focus on both. And then I think the third thing that we should mention in terms of eating disorders and co-occurring disorders is substance use disorders. So especially with bulimia and binge eating disorder, and in people with long-standing anorexia nervosa, we do see high rates of alcohol use disorder, smoking, as well as abuse of other illicit substances. So it's really a package, and we need to treat it as a package.
Thank you, Dr. Bulik. You brought up a subject that I know that you have strong opinions about, and that is treatment. So would you like to elaborate a little bit about the treatment of eating disorders, either independently, but then also along with the co-occurring illnesses? How good are we at treating eating disorders and the co-occurring? What are we doing well, and what do we need to do to improve?
Great question, Patty. And I'm going to break it down by disorder. So the disorder we're probably least competent in treating is anorexia nervosa. And for adults, that usually means inpatient renourishment if it's severe, followed by outpatient cognitive behavioral therapy or specialist supportive clinical management. For children, it's family-based treatment that very much focuses on the eating disorder. Unfortunately, when we look at those data, only about 30% of people with anorexia actually achieve long-term recovery. So we've got a lot of work to do in that space to improve outcome. We do a better job in bulimia and binge eating disorder. And a lot of that is through cognitive behavioral therapy. So we really go in there, we dissect the thoughts and the feelings and the behaviors, and we help people replace those unhealthy or unhelpful behaviors and thoughts with ones that are more health promoting. Now, that technique, cognitive behavioral therapy, is very effective for depression and anxiety disorders. In fact, it was developed for depression, and then we adapted it for the treatment of eating disorders. So with those co-occurring illnesses, depression and anxiety, coupled with bulimia and binge eating disorder, we do a pretty good job. Where we really fall flat on our face is when we have comorbidity of eating disorders and substance use disorders. In fact, what we often see is people sort of ping-ponging back and forth between an eating disorders treatment center and then a substance abuse treatment center, and one deals with one, the other deals with the other, and never should the two meet. So we desperately need help in figuring out how to treat them when they co-occur.
Okay, so you've kind of already answered the question that I was going to ask, which is, okay, if we're falling down in these areas, what do we need? We know what we're not doing well. When you say we desperately need help, is there something that you already know and understand that you need but don't have? Or are we still even really grasping for a straw that says, what is it that we're missing?
Well, for the eating disorders and substance abuse question, we really need to get started. For example, there's something that we see on college campuses all the time, which we call food-restricted alcohol consumption, which the media call drunkorexia. But we have people all over college campuses and elsewhere in life who will restrict their food intake either to compensate for the calories in alcohol or to get drunk faster. We see that in men often.
And doctor, I didn't realize there was a name for that. That's just something I remember back in the 80s when I was in college. That's just kind of something everybody did. If you knew you were going out to a happy hour, you didn't eat until way later on in the night.
Exactly. And, that prompts binge eating. That also increases the risk for alcohol toxicity because that alcohol gets into your bloodstream much quicker if you haven't eaten for hours.
Right.
So we see emergency room presentations of kids who do this all the time. But I don't think there's a single clinical trial out there that has addressed how do we treat this? How do we prevent this?
Well, how do we educate young people going off to school? You go off to school, and this is one of those things you wouldn't even think of, and if everybody else is doing it, well, this just must be the college way. And then all of a sudden you hear of these alcohol poisoning deaths in college or asphyxiation. Well, it could be caused from this.
Absolutely. And it is so, you don't want to send your kid off to college and have them die.
Right.
And unfortunately it happens for too many different reasons. But this is such an important time when we can intervene and prevent. The eating disorders and substance use on campuses are just rampant, and we really have to do a much better job educating, preventing, and intervening early.
I think this gets back, Dr. Bulik, to what you talked about in the beginning, which is if we can uncover all of the stigma and the embarrassment and the shame of discussing these issues, then it's going to be an easier conversation when you send your kids off to school about the things that they should be aware of, the things they need to do, the things they need to avoid. Educate the nurses on campus, educate the coaches, the teachers, the kids. Just bring it out in the open, and don't be ashamed to say, oh, by the way, you might be given this opportunity. Be mindful of what it can lead to.
No, you're so right. And it's people having the guts to come forward and talking about their own issues. I'm actually in the middle of reading one of your Texas colleagues, Brian Cuban's book, The Addicted Lawyer, and he talks a lot about this drunkorexia phenomenon. And he has the guts to get out there and say, I did this during college. I did this during law school. It's going to mess you up like it messed me up. And those personal stories often have more impact than facts and figures do.
Exactly.
So we need those champions to really come out and say, hey, there's nothing shameful about this. There's a genetic component to this. There's a psychological component to this, but you can recover. I have, and you can too, but let's talk about it to make that possible.
And thank you so much, Dr. Bulik. Can you stay with us for after the break, because we want to talk about some other important things coming up this month in September?
sure.
Thank you so much. Again, we're JP, Kathy, and the crew on 1160 AM KBDT. And from now on, every Tuesday, we will be bringing you our mental health moment. We're super excited that we've got Patty Gillot from the Kelly Foundation or something for Kelly. And thank you. And then we've also got Steve Dunn from the Morgan Foundation. We'll be right back with Dr. Cynthia Bulik after these messages.
Okay.
Hello.
There we go.
All right. So this is okay. Everybody do a test into your mic real quick. Test. Okay, we're good. Excellent. Yay.
Doctor, will you be able to sum up the edgy the study you're about to jump into, in a very succinct way? Because I know we don't have too much time left.
Is September Suicide Prevention Month?
I can do succinct.
Can we also bring up that September is Suicide Prevention Month? I think we need to talk about that every single Tuesday from now until the end of September.
Okay.
So I'll feed you something to bring that up, and then let you wrap it up in a nice bow.
And I'm still trying to get Vanita on, because she started the Grant Halliburton Foundation after her son took his life, and they are a pretty big player here. I've reached out to her a few times,
huge.
And hopefully
during Suicide Prevention Month,
absolutely,
if we could, that's everybody knows somebody.
Absolutely.
Everybody knows.
And Dr. Bulik, we got a list of guest speakers from Carolyn Becker, and one of them is somebody who you probably know in the list of CAPS for suicide prevention. So we're going to reach out to Dr. Knock and see if he can join us.
Okay, good. Another person who's wonderful is Tom Joyner.
Okay. Is he part of the
I'll send you his email.
Yes, send me his info, and we'll.
He's in Florida, and he's just a wonderful speaker.
And I think he's on the list. Well, we're going to have Dr. Holland from Vanderbilt. We just heard from Dr. Teachman from Virginia. She'll be on in October. And so we're just running down the list and trying to get all these folks in.
Wonderful. Yay.
Yes, anybody that you think should join us for any of the mental health moment subjects that you're aware of, please send them our way. We'll be happy to include them in the list.
Wonderful. Well, happy to send you more people.
Yay.
So how much longer are you here in the States?
Until the 15th of September.
And then you're gone for how long?
Just about 3 weeks this time.
Okay. That's not too bad.
Yeah.
Oh, and between you, us, and the fence post here, how is your dad?
He actually looked, knock on wood, he looked a little bit better when I was down there this time.
Good.
That's nice.
Yeah, so I came back feeling like treatment's going in the right direction. So
that is good to hear.
Thanks for asking.
Yeah, I had the joy of seeing my dad in the hospital yesterday. He's got this obstructive.
Is he okay?
Yeah, I think so. He's just going to be there for a few days. He's 88.
Yeah, but he looks great.
Yeah, he does. Yes, he does.
I always forget his age whenever I'm around him.
He does look good.
1 minute.
And he wears bow ties now.
Yes, he does.
Time.
I love it. I love it.
But yeah, if possible, would like to briefly touched on how the EDGI study is going to be, inclusive, and how you plan to address some of the issues that or non-issues that are raised about it being, it needs to be all inclusive.
Yes.
Okay, we've got about 30 seconds.
Okay.
You're doing a great job. I know. We need another hour.
Well, fortunately, we have every Tuesday.
Every week.
To get this out in front of people.
Fly.
It really does. Everybody, people will be
10
like,
seconds.
do this. And they're like, oh, that's too long. I'm like, just wait till you're in studio.
Yeah.
Just wait. Good morning and welcome back to JP, Kathy, and the crew here on 1160 AM KBDT, where you can hear us every Monday through Friday from 7 to 9 a.m. Mark your calendar. Every Tuesday at 8:30, we are going to be doing the JP, Kathy, and the crew mental health moment. super excited that we've got Dr. Cynthia Bulik, who is kicking off our mental health moment, along with our friends and dear members of the crew, Steve Dunn from the Morgan Foundation and Patty Giolot. I don't say it as fancy as JP does, sorry, from Something for Kelly. So we were talking before the break about a plethora of topics, and we were talking about eating disorders in particular, and then how that, and what was it called? Drunkorexia and restrictive caloric alcohol. I'm
Food
butchering
restricted, caloric, whatever. We'll call it frac for short.
There you go. Well, and so there are all of these things out there that we really, there's so much that we need to be educating our kids about, and we need to educate ourselves about as parents and as mental health people and mental health advocates. One of the things we want to talk about, especially, and I think it's very fitting because I know particularly we've dealt with suicide with a friend of my daughter. Everybody deals with suicide. And again, we're not going to be afraid to talk about these things. And September is Suicide Awareness Month. Is that correct?
Yes, it is.
So, Patty, let's talk about that and how important it is to bring the topic of suicide up when we're talking about mental health, because that's the ultimate, the ultimate heartbreak when you lose somebody to suicide.
Absolutely, Kathy. And this is critical. Again, I think that people are so ill-informed as it relates to the high rate of intentional suicide that people attempt.
Right.
When they are struggling with eating disorders. Self-harm is the first step. If you are aware even remotely of the extent of self-harm for patients with eating disorders, then that is just a gateway, a cry for help when they continue to escalate that behavior.
When you're talking about self-help, especially or self-harm, especially if there's somebody out there who has not heard of this, or maybe it's happening and they don't know it, what does self-harm look like? How does it manifest itself?
Well, a lot of times first of all, they know that what they're doing is wrong. They're ashamed of what they're doing. So they're not going to do it in a very obvious way.
Okay.
You probably are not going to see where they are attempting to hurt themselves.
Okay.
It's going to be under their clothes. They're going to be wearing long sleeves. They're going to be hiding it in some way. They're going to be in the bathroom for extended periods of time, out of the ordinary. Just pay attention to things that look different. Did they used to engage more? Are they now more isolated? Did they used to have a lot of friends? Do they now not care about going out with friends? Just look for abnormal behavior. I think that would be one of the primary things that I would raise up.
Okay. And Dr. Bulik, are there any other things you can help as far as signs to look for that someone who you love might be headed towards suicide? What are some of those signs that people can look for right away?
Yeah, and we're talking about two different things. We're talking about self-harm and suicide, and I'm going to add to Patty's list. Sometimes people who self-harm, they have little kits. They have little boxes that they hide their razors or whatever in, and if you find something like that in your child's desk or closet, it's got to raise a huge red flag, and you've got to jump on it immediately. But for anorexia, suicide's the second most common reason for death. And suicide rates are elevated in all of the eating disorders. And, I think the thing that I struggle with is how much parents feel shame if their child commits suicide. And, of all the things that we desperately need to talk about, it's suicide, so we can get support from each other when we experience it.
You're right.
I had 2 friends commit suicide when I was a kid, and I have never forgotten that. It had a huge impact on my life. So, I think we really need to feel comfortable saying, yeah, I hear how absolutely horrible. There really is no worse experience than having someone in your life take their own life. So we need to support those people by talking about it.
I think that is very critical, Dr. Bulik. I once was in a conversation and I heard somebody ask a professional about taking these questions seriously, or these attempts. And it was like every cry you need to take seriously.
Absolutely.
Every attempt you need to take
Absolutely.
as if it's real.
I agree.
Better safe than sorry. Better safe than sorry.
Yeah.
Absolutely. Well, thank you so much, Dr. Bulik, for joining us. Thank you, Patty, and thank you, Steve, for joining us. We are very, very proud of this segment here on JP, Kathy, and the Crew. And again, this will be brought to you every Tuesday, our mental health moment, without fail, on JP, Kathy, and the Crew. Everybody have a blessed day. If you're joining us for our Oh, our fantasy football draft tonight. Good luck. We're all hoping it really happens tonight. We hope you have a fantastic day. Take care of those you love. Squeeze them a little tighter. Give them a hug and tell those people you love that you love them. It is JP, Kathy, and crew on 1160 AM KBDT News Talk Sports. Talk to you tomorrow. Have a blessed day. Great job, doctor. Thank you so much.
Sure, we didn't get to everything we wanted to, but we got to important stuff.
And I think when Patty mentioned about it being suicide prevention month starting off, I just thought that was so important to kick that in there because
totally agree.
You just, everybody knows somebody who has committed suicide or has been touched by it in some way, shape, or form. And like you said, this is something, if we had another hour, that we would get into, and that's intended suicide versus unintended suicide.
That's a lot.
Which a lot of times happens in that eating disorder community.
Absolutely. I mean, people who are starving themselves are not intentionally committing suicide.
No, but eventually
And then, of course, there are the actual attempts that are intentional.
I think
right. Oh, and what, doctor?
Oh, my.
Oh,
hello.
We may have lost her. Doctor? Oh, shoot, we may have lost her.
Going once.
Okay. All right. Okay. Well, y'all say bye to Facebook.
Goodbye,
Goodbye, Facebook. See you guys next week.
Love y'all. Thanks. Everybody have a blessed day. Share this information with people you love. Let them know they don't have to listen to the rest of the ridiculousness of JP and I. Well, they would want to listen to the congressman. That wasn't ridiculous. That was a good segment. But, even if you just share our show every Tuesday and tell people to start watching at the hour and a half mark, this is important stuff. So we want to bring this conversation out in the open and have everybody talk about it in a very open dialogue. And like you said, not be worried about talking about it and who you're saying it to. So help us with that. We need help from the crew with that. Love y'all.
Kathy, in fact, next week we're going to have a gentleman, a local guy. His name is Phil Von Gilder.
Okay.
He knows everyone.
Oh,
Okay. So he's going to have, we anticipate a list of resources for different mental illnesses. He knows all of the treatment providers. And I think he's just going to do a wonderful, he's very charismatic as well.
Yes.
Love it.
Very excited to have him.
So tune in next Tuesday as well, but tune in tomorrow too. So
Thank you. Bye, Facebook.
Love you.
Bye. Bye. Thank you.
The time flies.
Hey.